situation?
Sure. No, we're doing fine. I'm in Des Moines, Iowa. I'm retired endodontist, though I still have practiced over at our county hospital. And all of our patients over there have been, unless they're an emergency patient, they've been canceled. Any elective procedures have totally been canceled. So again, Iowa does not have a stay-at-home policy yet. We suspect that it'll be within the next couple of days, the governor will put that into place. But essentially, we're hunkered down. Haven't seen my grandchildren that are local for about now 2 weeks. So we're trying to social distance ourselves. Again, I don't think I've ever done a virtual church service before, but I have now. So again, I think all of us are trying to practice what's being evoked as far as the best practices for society. So.
Well, it does sound like you're making the best out of what is a difficult situation for many. I know from talking with a lot of dentists the last couple of weeks, most practices are shuttered to all but emergency patients. But what is that like for an endodontic practice where you tend to see a higher percentage of emergencies?
Actually, I think with the way the emergencies have evolved, and this is information that I'm getting from our members almost daily, I could probably go to my email right now and have some other member that's contacted me telling about hardships and what have you. But there are practices that are maybe having one person in the practice stay there daily to take referred emergencies. And they're able to do that by following some of our guidelines that we've already elaborated and have done so very quickly over the last 10 days. So,
can you tell me about what some of the guidance that the AAE is providing to dentists who are practicing right now?
Well, for one thing, and I wanted to let you know, especially if other specialties or dentists see this, that our website, AAE.org, has a button for professionals that will take you to what I'm about to tell you. There have been 2 articles that have been fast-tracked to our Journal of Endodontics. The first article actually was from authors at the University of Texas, San Antonio, outlining best practices using CDC guidelines as well as guidelines developed within the University of Texas in San Antonio. And that has been shared in an article that was fast-tracked and is available to any dentist that is out there. And again, that's AAE.org. We'll take you to that and you just go through the buttons. The other thing with that article, what's emphasized is that we try and do teledentistry if possible. If the patient is referred to an office, the office will contact them and go through a series of questions, basically asking about history of past travel, if they have a fever, if they have swelling, and then if they have severe pain and what may initiate that pain. So they'll do typically a screening that way. Again, if they believe there are some other questions that can be asked that are also given in the article that I was just talking about that help you differentiate whether or not the patient should be brought in for a emergency. So, they're doing that. And then for patients that are being treated that require the use of the dental high-speed handpiece, they're practicing all of the CDC guidelines. We are having some difficulty getting N95 masks and some shields, but they're doing the best they can with what they have in most instances. To that end, just 2 days ago, we put out a plea to the governors and to the public health officials to please consider endodontists as essential emergency health care providers. And what that request is for is to then make personal protective equipment, such as the N95 mask, more available to those endodontists that are actually treating these emergencies. The emergencies, the true dental emergencies, if they were to go to the ER, unfortunately, probably aren't going to get treated in a proper manner because ER docs are not trained to do that. It also would put a burden on the emergency room personnel to try to admit them. They go through this in a whole different scenario without COVID-19. The cost for a hospital seeing a dental emergency is about $1,800 according to information that's out there, and so it's very expensive for them to even go in there. So as an endodontist, if we can treat those patients in our office and prevent them from having to go to an emergency room, that's one less patient taking away from the patients that need to be treated, especially with the COVID-19 out there. So we see it as we're part of a group of specialists that are treating emergency patients, and along with oral surgeons and with some of the pediatric dentists that are treating emergency patients. So we feel like that's one of the things that we can do as a specialty to help relieve the burden of the emergency room doctors. So.
Do emergency rooms generally have an endodontist, kind of on speed dial, someone they know they can refer out to?
Not necessarily, and that we have something else for you to pass along. We have a link that's called FineMyEndodontistcom that anybody can hit that and find an endodontist. So I have lectured to ER docs about this and trying to give them some resources, and have encouraged them to find the local endodontist in their area using that particular link. And again, for our patients that may be searching for assistance, we would suggest that they use FineMyEndodontistcom, and they can look for an endodontist in their local area. So again, that's a resource we're trying to provide. Again, is doing our part for this whole thing. So,
and in terms of, have you been talking to your members about the types of cases they're seeing? Are people who trying to get in to see their regular dentist, finding their practice is completely closed, coming to endodontists with non-emergency cases right now?
No, I think the endodontists are pretty much screening, using the Tele dentistry, if you will, to screen those patients, and they're really only trying to treat the true emergencies, the ones that have swelling that's associated with the tooth, fever that's associated with an infected tooth, or patients in intractable pain due to an extreme inflammation to the inside of the tooth. So they're screening. They're not trying to bleach teeth internally. They're not trying to do anything like that. It's not. There's no unneeded treatment. Everybody is being set back until the office gets the all clear.
While treating these patients, are there any specific, procedures that the endodontists are being recommended to use that would be different than their normal practices? I know that, we practice in a pretty controlled environment when it comes to infection control procedures anyway.
Right. Of course, one of the things that CDC has recommended for dentistry is to use a rubber dam if you do have to do a procedure. That's standard of care for us. I mean, again, there's no problem there. If they cannot get a face shield that fits over their mask in glasses, they can use goggles, according to CDC, and again on N95 mask if they can get it. Otherwise, I am hearing that they're using the type 3 mask and double masking, trying to give themselves as much protection that way. So that's the big thing. And then again, trying to reduce aerosols as much as possible. So.
Mm-hmm. And, in terms of those masks, I know, obviously N95 masks are in short supply.
Yep.
I've seen a lot of, coverage. I'm actually working on some coverage right now about a lot of dental labs starting to use their 3D printing capabilities to create face shields and other things.
Mm-hmm.
Have the AAE looked into, helping dentists connect with those types of operations to get access to these resources?
I think those are being done locally by the local groups, but yeah, we have stories about that that have been given to our members. Every Friday morning, we have a release of all the pertinent stories that have been over the past week, and including our releases. So again, they do get those resources, and the 3D printing has been very interesting. As far as I think, the first time I saw that being done was by physicians at Columbia to come up with the structure for the face shields to fit on. So yeah.
Mm-hmm. Yeah, it's been neat to see people step up in that way to help out. In terms of just, getting the public to understand who endodontists are and how to approach them in this time, is there kind of more outreach needed both to the larger healthcare community and the public to explain why you should see an endodontist if you have this type of critical tooth pain right now?
Well, I think unfortunately, I think a lot of the general dentists are shut down. And again, if they probably the majority of our referrals, our patients are referrals into the office, and with patients that have had prior root canals, actually understanding what they're looking for as far as the symptoms. And those patients, there are repeat patients, unfortunately for them. But again, we're available. But yeah, the general public, when you usually say endodontist, they go, "Oh, you're straightening teeth?" And we go, "No." So there is always that confusion. It seems like the now 10 different dental specialties aren't always distinguished in the public's mind, but endodontists we are the specialty that are trained in pain management. We're trained in diagnosis, and we're trained in the treatment of both the soft tissue that's inside of the tooth as well as abscesses that may develop in bone. And that is our whole focus. So if a patient has, for instance, has severe pain to hot or cold, an endodontist is the one to be seen for that. The further back the pain is, the more complex usually the tooth anatomy is. And again, another reason for endodontists to be consulted, because we're trained to treat all of the complex anatomies that exist and can exist. Again, sometimes the simpler cases, maybe up front, where they're not as complex, can be treated by a well-trained general dentist. But otherwise, the complex pain that may be further back, I think is best addressed by a specialist.
What are you hearing from your members about how they're handling staffing at their practice? I know, speaking to some general dentists who have remained open for emergencies, they've really cut down on that.
Again, typically what I am hearing, if it's a multi-endodontic practice, that they're just having minimal staff. Again, if they have a front desk person answering telephone calls, that may be the person that greets the patient coming in. They're doing social distancing, asking patients to stay 6 feet away. And again, if they have a questionnaire that needs to be filled out, it's placed 6 feet away. They can fill it out and then step back. And again, limiting waiting room people. Patients, again, that actually require emergency treatment are asked not to bring unnecessary individuals with them. If they do, we're asking them to please stay in the car and not come in. And again, all of the social distancing things, along with frequent hand washing, again, all of those are being practiced within the office. So.
Mm-hmm. You had mentioned that you're working to get endodontists included in the list for priority access to PPE resources.
Right.
Aside from that, are there other challenges that AAE members are facing right now?
Well, I think that like all dentists, as everything has slowed down, there's financial challenges that everyone is facing, and again, they're being referred to the appropriate government organizations to seek help for some of that. I think there was a small business loan that expired this past Tuesday. They were all advised that to take a look at that if they are having financial problems. Again, one of the things that we anticipate is that once we get back into action as an entire dental community, is that they may be overloaded with the backlog. How do you handle that? So the offices that I talk to are maintaining staff. Usually in my own case, before I retired, I had 2 dental assistants, one for 23 years, one for 16. And they made me work very efficiently. And I loved working with these women that actually made it kind of fun to go to work. I'll put it that way. And they were valuable people to me. And I always valued my dental assistants to the point where I hated to have any turnover. So I did everything I could to keep them going. And we've had some the recession in 2008, 2009. We still kept plowing along, even though there was reduced patients. So again, taking care of the staff. Again, avoiding having unneeded exposures. Again, if we, in doing the screening, if we suspect that somebody is a COVID-19 carrier or has had that kind of exposure history, unless they were having really urgent emergency, we would prefer that they would be go to a ER. And many of these minor to moderate types of pains can be managed with just simply over-the-counter acetaminophen with ibuprofen. And that also avoids what frequently will happen in an emergency room is the physicians will give unnecessary antibiotics and opioids. And so, again, I think consulting with an endodontist, we're very in tune with pain management and have the research to back that up, that they're probably better off with acetaminophen and NSAIDs than they are with opioids anyway. So,
now with the current situation, you mentioned possible backlog of patients when people open up. I also imagine we're going to be facing possible shortages of some supplies at that same time. Is there anything going on to kind of prepare members to be ready for that?
Again, it's local sourcing right now. It seems like again the shortages. And I'll also say this: there have been states that have asked all of the dentists to give their surplus PPE to hospitals, so that, and a lot of our dentists have done that, but maybe to the detriment if there is a break in supply chain. So again, we are taking a look at that and trying to ensure that they do have the local resources, but most often it's done by the individuals within each state or city. So depending on where they are. So.
Earlier, you mentioned that a lot of the members are using teledentistry for screenings before patients come in when they can. Do you know how prevalent this technology was in use among endodontists, members of the AAE before this?
not very.
Mhm.
You know, again, it probably wasn't very
Mhm.
prevalent. Again, it's new. Everything using
Mhm.
Zoom wasn't very prevalent, 3 weeks ago.
Yep.
So I've become pretty good at this. So.
Mhm. So basically, the members have shown they can adapt pretty quickly. We've got technology to provide care to patients when they're needing care, and it's really a matter of making sure the right patients get to the right practices.
Yes, exactly.
Mhm.
And
Mhm.
again, I'll plug Find My Endodontist. If a patient is perchance viewing this, that is what they can use to find an endodontist in their area using that log on. So.
Mhm. Well, Dr. Krell, is there anything else that you really feel that would be important to share about what's going on right now with endodontists and the general response to the COVID pandemic?
It's our response has been let's get as much information as we can out to our members. Again, on Monday there will be another COVID-19 update on our website. The latest piece of information was just released yesterday, and that was April 2nd, which is an article that is also available on our website, AAE.org. And it's the characteristics of endodontic emergencies during COVID-19 outbreak in Wuhan. And
Mhm.
this is coming from some endodontists that were at the hospital. And it's very interesting. They had at that hospital, they were referred at least 100 emergencies within this time frame. And the majority of them were symptomatic irreversible pulpituses. The others were abscesses. And again, they were able to successfully treat those patients, preventing them from having to go to the ER. And none of the workers and they have all of their systems that they use. None of their workers contracted COVID-19. So again, with safe practices and careful practice and careful screening, I think these dental emergencies can still be seen with minimal risk to our providers. So.
Mhm. Well, Dr. Krell, we really appreciate you taking the time to join us today and to share all this information about everything that's going on. Thanks very much and stay safe.
You also.